Well, we spoke to Dr. Mpho Maja, who is Director of Animal Health at the Department of Agriculture, Land Reform and Rural Development about the outbreak. Dr. Maja started by wishing all veterinarians a happy Veterinarians Day just before breaking down what this flu means for the poultry farming industry at large.
Let me wish all veterinarians out there a happy World Veterinary Day. This is our day. And yes, we play a crucial role in animal health, and I'm happy to be taking this evening. The origin of avian influenza is influenzas are viruses that affect basically animals, and there's even human influenza viruses. There's over 200 birds that have been affected at the moment in the Western Cape. We have reports of 2 confirmed cases and 2 that we are investigating. We are still waiting for the results from the laboratory.
Thank you very much for that update. Perhaps as we look at how the highly pathogen avian flu outbreaks have been detected in poultry, in other provinces in South Africa in the last 16 months. Perhaps you could talk to the signs that, one should be looking out for amongst the avian or birds.
Avian influenza manifests itself typically as you would see birds that would be depressed. They would not be feeding properly like you would expect them to feed. They wouldn't be drinking water as you would expect them to be drinking. They also have swelling around the face. The top of the birds would be swollen. They generally look very unhappy. But the most important sign is that they also cause high mortalities. So by the time you realize that your birds are sick, there's quite a number that have already died. And that is what draws your attention to that there's something not quite right in my poultry house.
Well, speaking of, high mortality rates amongst birds, and also just the signs and symptoms, is there a vaccine or treatment available? What could be done to perhaps curb the spread of avian flu?
There are vaccines available around the world. We don't have any that is registered for use in South Africa yet. We are investigating the possibility of vaccinating with industry. Unfortunately, there's a lot of pros and cons that we have to weigh between the producer and the regulator with regards to, do we vaccinate, do we not vaccinate? If we do vaccinate, which vaccines are we going to use? Are they compatible with the virus that's currently circulating? How do we monitor incursion into poultry houses once a house is vaccinated? What biosecurity measures are we going to put in place? So there's quite a lot that's going into the vaccine discussions, whether to vaccinate or not to vaccinate. So far, the best measure remains prevention. We are encouraging industry to improve their biosecurity measures, make sure that they don't attract wild birds onto their premises, disinfect thoroughly before entering the poultry house. Don't allow anybody, including feed trucks, including trucks that come and collect eggs from your premises, make sure that they are thoroughly disinfected before they enter your premises. So if we improved biosecurity, the need to vaccinate becomes so much less.
Dr. Mpho, thank you for that context as well, because I was also trying to understand alternative treatments, as we assess the pros and cons for that matter, perhaps the best practice in dealing with the avian flu outbreak. Some have called for, the use of heat treatment protocol as, and this was advocated by some. Is this also an alternative that could be explored?
The heat treatment that industry is calling for is mainly for product that we are importing from countries that would have reported avian influenza outbreaks. We do that anyway as a general means. Once a country reports avian influenza, highly pathogenic avian influenza on their territory. We suspend trade of raw poultry meat as well as live birds. So the only commodity that we allow importation of is products that have been heat treated according to the World Organization for Animal Health measures that they have put in place. If those products are already heat treated, then they are free to come into the country. With regards to our local producers, because of the rate at which avian influenza goes through the farm that's affected, it's not possible for them to slaughter and therefore not possible for them to heat treat product that's coming from that farm.
I think the concern amongst many is whether the avian flu, has spread onto mammals. What is the impact on humans and upon consumption as well? Are there any concerns about food security in the country on the back of the threat or the outbreak of avian flu in South Africa?
Avian influenza and like other influenzas, it has a tendency of affecting mammals, yes. Fortunately, we have not had avian influenza crossing species in the country. We haven't seen it in any other animals. We haven't seen it in humans either. But we remain cautious, and we also advise farm workers, abattoir workers to please remain vigilant, because you never know when it will cross that species border. But with regards to food security, at the moment, I do not think that it will cause that much of a food security issue. It does affect large producers rather, and you tend to have large mortalities of birds and therefore affecting some level of food production and therefore food security. But I'm hoping that because we are increasing and improving our biosecurity measures and being vigilant, that we are going to reduce the level of incursion and therefore the level of infection onto farms.
Dr. Mpho, these updates are obviously useful for the public at large, just given the dynamics that unfold, also the threats thereof. Perhaps you could just speak to, very lastly, about reporting incidences. How do people who are in the industry suspect that they are affected by it? How do they go about reporting it? And what measures are also put in place to assist those who obviously set to lose a lot of livestock or a lot of animals?
We have contact details of our state veterinary officers on the department's website. They can also phone the provincial director's office to get the local state vet contacts. With regards to the owners that are losing a large number of their livestock, provinces have programs that support farms and support farmers. So they are also encouraged to approach those provinces to support for whatever losses that they may have incurred. But also above that, the Act has a section in there that if anybody has their animals having destroyed pursuant to a control measure, they can apply to our office for compensation. But that comes at following a tedious process of evaluating the risk, the biosecurity measures that were on the farm, for us to be able to evaluate the amount that would be due to a producer that may have lost animals.
Dr. Mpho Maja, thank you for your time here on the SABC. Let's continue to monitor developments as it unfolds. We'll leave that conversation there. Dr. Mpho Maja, Director of Animal Health at the Department of Agriculture, Land Reform and Rural Development. Weighing in the back of 2 incidences reported at layer farms in the Western Cape. This is avian flu was detected there at 2 commercial farms. So again, speaking about the signs and symptoms, the impact on food security in the country, and perhaps ways people can report should they suspect any incidences.